Chapter 5, Video 1. Today we're going to talk about enteral nutrition, okay? Enteral nutrition allows for food to be placed directly into the stomach. And if you look at these pictures here, we have what we call an NG tube. That's a nasogastric tube, and it's actually inserted in through the nose, and it goes down your throat into the stomach. And then we have what we call a PEG tube, which is inserted through an abdominal opening. It's a surgical opening, okay? But enteral nutrition is food being placed directly into the stomach. You need to know the difference between enteral nutrition and TPN. TPN stands for total parenteral nutrition. And this is nourishment that is delivered directly into the bloodstream. So please know the difference there. TPN is total parenteral nutrition. It's delivered directly into the bloodstream. And then enteral nutrition that you see here is food being placed directly into the stomach, okay? We have a nasogastric or a nasointestinal tube. The enteral nutrition is called tube feeding because it is food in a formula-like fluid that is delivered through a tube that has been inserted in through the nose, okay? So the nasogastric or the nasointestinal tube, naso here stands for nose, so that lets you know that it's going in through the nose. That tube has been sent down through the nose. The nasogastric tube is inserted through the nose, down the throat, and into the stomach. The nasointestinal tube is inserted through the nose, down the throat, and into the small intestine. Okay, so that's the difference here. The gastric is in the stomach, the intestines in the small intestines, but it's still sent with a tube through the nose, down the throat. So please understand that. Enteral nutrition is used often with patients experiencing dementia because they forget to eat and they've lost their ability to swallow. So their brain is not telling them to eat, and their brain is not telling them to swallow. So oftentimes we see enteral nutrition with these guys. The nasogastric tube, again, is food placed directly into the stomach through the tube, and it goes down the nose into the throat. Into the stomach after the throat. Through the nose, down the throat, and into the stomach. There are risks that are associated with the use of a nasogastric tube or a nasointestinal tube. These are only for short-term use because they can be very irritating to the back of the nose and the back of the throat. And they're often easily displaced. If a patient coughs, vomits, or pulls the tube, they could be misplaced. One of the risks with this tube is making sure that it gets to the stomach, because when you send it down the nose, it could actually go into the lungs if you're not careful. So making sure that you insert this correctly, send it down the nose, have the patient swallow, and making sure that it gets down into the stomach is huge, because we do run the risk of these being misplaced and flipping up into the lungs. We want to make sure that we apply tape to the tube and anchor it at the nose or the cheek. You want to make sure that it's secure but not pulled too tightly, because it could break down the skin. And I can show you that in lab as well. Pressure sores is a risk associated with a nasogastric or nasointestinal. Irritation or crusting of mucus can occur around the nostril. And then if the tube is passed into the lungs, they may experience difficult breathing. They may get aspiration pneumonia. This is when fluid is entered into the lungs. They could go into respiratory arrest, and this could even result into death. There's ways that we can confirm that the tube is placed properly. We want to measure the length of the tubing that extends out of the body from the nostril to the end of the tube. We want to check and make sure that that length has not changed since the tube has been inserted. So we'll mark that tube, and we need to check and make sure that that tube is still in place, because we can verify it by that length. One thing that we do before we feed the patient is we can withdraw some of the stomach contents using a large bore syringe, okay? And I can show you one of them in lab. There's a big syringe, and we can pull back and just make sure that we have stomach juice. And then you can insert air back in through that tube, and you can place a stethoscope over the patient's stomach and listen, and you should hear a bubble if you're in the stomach. And if you don't hear that bubble, then you know you're not in the stomach. You may need to have an x-ray done or verify that that tube is in place. Tell whether the following statement is true or false. It is not important to check nasogastric tube placement after insertion. The answer to this is obviously false. It is very important to always check the placement of the nasogastric tube. If nasogastric tube is not in the proper place, the patient could experience aspiration. It could cause coughing, discomfort, pneumonia, and even respiratory arrest. That is it for Chapter 5, Video 1. If you have any questions, please let me know.